Hey everyone, welcome back. Today we're going to really get into MOG IgG testing. It's one of those things that's been getting more and more attention lately, especially for folks who are dealing with MS or maybe some other conditions that, affect myelin.
Absolutely. It's definitely a hot topic. MOG IgG, just to break it down, those are antibodies that target a very specific protein on myelin. So think of them kind of like red flags, right? They're signaling, hey, there might be something going on here. And they're a super important piece of the puzzle when we're trying to diagnose something called MOGAD. MOG Antibody Associated Disease. That's what that stands for.
So it's like MOG IgG is the clue and MOGAD is the possible suspect. What I find super interesting is that for a while, MOGAD was kind of lumped in with multiple sclerosis, wasn't it?
That's right, yeah. But the more we learn, the more we're realizing that MOGAD is its own separate thing. It needs its own approach, its own way of looking at it.
And that's where this deep dive comes in. We're going to try to figure out, who should even be getting this test? What do the results really tell us? And what's the latest? What's new in the science of MOGAD? So it's kind of like your own MOG-IG cheat sheet.
Exactly. And the very first thing to understand about this whole thing is that this test isn't for everyone. It's not something you should just, order for no reason. It's more of a targeted tool, you know what I mean? Only when we really suspect MOGAD is a possibility.
So it's not like any headache and you run to get this test.
Right. There are some really specific symptoms and ways it presents that make us go, maybe this could be MOGAD.
Yeah.
Like the 2023 MOGAD criteria, those lay it all out pretty clearly. Things like optic neuritis, when the optic nerve gets inflamed, or myelitis, which affects the spinal cord, brainstem, or cerebellar demyelination, ADM, even some cerebral syndromes too. These are the main players that make us think, okay, time to investigate MOGAD.
I was reading about how even aseptic meningitis, which I always thought was just purely from an infection, might sometimes be connected to MOGAD. It's wild how much we're still learning about this stuff.
Oh, for sure. That's one of those areas that we're still actively exploring, and it just shows how complex this whole field is.
Wow.
There are rarely easy answers. There's research out there, like that paper from Gambale and Gatti back in 2021, that's really pushing our understanding further.
And it gets even trickier with kids, right? Because I've heard that they might have MOGAD, but their MRIs don't show the classic lesions you'd expect.
You're right. That's a really good point. Diagnosing MOGAD in kids can be a whole different ballgame because they don't always present textbook cases. There's some research from Fonseca and his team, and also from Kashigura's group, both came out in 2024, by the way, that really highlight how tricky it can be. It's a good reminder that we need to consider the whole picture, not just rely on, one test or one finding.
So let's bring this back to our listeners for a second. Why is it so important not to just test everyone for MAB-IG? Where's the harm in being extra careful, right?
Well, think about it this way. No test is perfect, right? Every single test has a chance of getting it wrong. And specifically with the MAG-IG test, if we use it when the chances of someone actually having MAGOD are low, then we increase the risk of getting a false positive, meaning the test says they have the antibodies, but they actually don't.
And a false positive, that's not just it could lead to the wrong diagnosis, a ton of worry, and even treatments that weren't needed in the first place.
Precisely. We have to be very careful about how we use these tools and make sure they're truly benefiting the patient in the long run.
Yeah, okay, I see what you mean. So let's say someone has some of those core symptoms we talked about, and their doctor decides to go ahead with testing. What's the next step? How do they actually search for these MAG-IG antibodies?
Well, before we jump into the how, there's a really important concept we got to understand. It's called positive predictive value, PPV for short. Basically, this tells us how likely it is that a positive result actually means someone truly has MOGAD.
PPV, okay. Sounds super important, but kind of intimidating. Can you break that down for us a little bit?
Sure. Imagine you're fishing with a net, right? PPV is like knowing how much of what you catch is actually fish and not just seaweed or old boots. A high PPV means you're mostly catching fish, so you can trust your net more.
So higher PPV equals more confidence in the results, basically.
Exactly. And two things really affect the PPV when it comes to MOG-IgG testing. First, how likely was it that the person had a MOGAD before we even did the test? If they have a lot of those classic symptoms, the PPV goes up.
Makes sense. So if you already look like you might have MOGAD, a positive test result is more likely to be right.
Exactly. But if someone's symptoms are vague and they don't really fit the MOGAD picture, even a positive test result needs a closer look. Might not be the whole story.
So the context really matters. You said two things affect PPV. What's the second one?
It all comes down to the accuracy of the test itself, which brings us to those cell-based assays. We call them CBAs.
CBAs. You scientists love your acronyms.
I know, right? But trust me, they're pretty cool. Imagine like a tiny dish with cells, and these cells have MOG on their surface. Think of them like little flags. The CBA takes a sample of the patient's blood serum and mixes it with the cells in the dish. If there are MOG antibodies in that serum, they'll latch onto those MOG drugs.
I'm trying to picture this. So how do we know if it's a positive result? Do the cells start waving little white flags or something?
Not quite. More like microscopic fireworks. Haha. The test uses a special marker that glows, a fluorescent marker, and it attaches to those antibodies. So if the cells light up under the microscope, boom, that means MOG antibodies are there.
It's like a spotlight on those MOG antibodies if they're hiding out. Pretty neat. I've heard there are different kinds of these CBAs, though, right? Live ones and fixed ones. What's the difference? And does it really matter which one they use?
Great question. So yeah, there are two main types. Live CBAs, those use living cells during the test, as you might guess. And fixed CBOs, they use cells that have been, well, preserved, fixed. Live CBAs are generally considered to be more sensitive, meaning they're really good at picking up on even tiny amounts of those MOG antibodies.
So it sounds like live CBAs are the best, right? Catch as much as you can.
They're very good, yeah.
Yeah.
But there's a bit of a catch. Live CBAs usually need, like, specialized labs and expertise. So they might not be available everywhere, you know?
So it's a trade-off. Live ones are more sensitive, but harder to find, maybe. What about the fixed CBAs? What's the downside there?
Fixed CBAs are definitely more common. You'll find them in more places. That's because they're easier to ship and store. But some studies have shown that they might miss a small percentage of the positive cases that a live CBA would catch.
Wait, really? So you could get a negative result on a fixed CBA, but actually have those MOG antibodies?
It's possible, though not super common. There was some research back in 2020 and another study in 2024 that pointed out this potential difference between the two types. Again, it all comes back to why context is so important.
So if you're really suspicious of MOGAD and a fixed CBA comes back negative, it might be worth, like, pushing for a live CBA at a more specialized lab just to be absolutely sure.
That's a very reasonable takeaway, yeah.
Yeah.
But even with live CBAs, you can still have some variation in results, believe it or not. There are studies out there showing a whole range of MOGAG positivity in people with MS, and it seems to depend on the specific live CBA they used.
Wow, so even what's considered the gold standard isn't 100% consistent. What does that mean for someone trying to, like, make sense of their results?
It just reinforces why we always have to look at the entire picture. Not just the test result on its own, but the lab's expertise, how their specific test works, and all of the patient's symptoms and history. It all plays a part.
So it's not as simple as just a yes or no answer, huh? And speaking of nuances, I've heard that antibody levels, those titers, also matter a lot with MOG testing. Why are titers so important?
You're right, titers are crucial. It's not just about presence or absence of the antibodies, it's also about how much of them is there. And this is important because low titers tend to be less specific.
Okay, wait. Back up for a second. Remind me what specificity means in this context again.
Specificity is basically how good a test is at ruling OUT a condition. A very specific test is going to be really good at avoiding false positives, you know?
Got it. So a low titer on the MOG-IG test, that means there's a higher chance that it could be a false positive. Like the test is saying you have the antibodies, but actually you don't.
Exactly. The Mayo Clinic actually had some really interesting data on this. For low titers, the positive predictive value, that PPV we were talking about, it was only 51%. But for high titers, it shot up to 100%. Huge difference.
Wow, yeah, that really puts it into perspective. Higher titers, more confident we can be in that result. So how do doctors use these titers when they're making a diagnosis?
The 2023 MOGAD criteria, they actually use titers to add another layer of, well, let's say carefulness. If someone has a low titer, we need to see some additional stronger clinical features to support a MOGAD diagnosis. It's kind of like a yellow light, Proceed with caution.
So a low titer raises a flag, but we need more evidence to be truly sure. Okay, last question about what to test. We've been talking about blood serum this whole time, but what about testing cerebrospinal fluid, the CSF? Is that ever done for MOGAD IG?
That's a great question. Serum is definitely the preferred fluid for this test. It's usually enough. But there are some rare cases where someone might have MOG IgE in their CSF but not in their blood. We call that isolated CSF positivity.
And that's where things get a bit murky, right? Because scientists are still trying to figure out what that isolated CSF positivity actually means. It's like finding a clue at a crime scene, but you don't know if it's actually related to the case.
Perfect analogy. And the research on this is still going on. We're seeing numbers for isolated CSF positivity anywhere from like 0% to 30%, depending on the study you look at.
That's a huge range, so we don't even know how often it happens, let alone what it means. Plus, doesn't the chance of a false positive with CSF testing also vary a lot?
You're absolutely right. The percentage of those isolated CSF positives that are considered false positives, well, that ranges from 0% to over 50%, makes it tough to interpret. So if they do test the CSF, the lab's expertise and the way their specific assay works are really, really important.
Okay, so lots of unknowns still with CSF testing for MOGAD-GG. It sounds like unless there's a really, really strong suspicion of MOGAD and the serum test is negative, it's probably best to stick with blood serum for now.
I'd agree with that. And this brings us back to the core purpose of this whole MOG-IgG testing thing,
Yeah.
diagnosis. This test is meant to help us pinpoint MOGAD, not screen everyone for it. It's one piece of the puzzle, not the whole picture. It's pretty amazing, how much research is going on right now with MOGAD. They're looking at, well, everything from like, what does it mean long-term if you keep having those antibodies, to can we use repeat testing to figure out the best treatment, things like that.
It seems like the science is finally catching up to this condition that for a long time was kind of hidden, even though it was right there in front of us. So to recap a bit, what we've learned so far is that MOGA-GG testing, it's a powerful tool, but it's not like a magic solution or anything. Titers are important. When you do the test, the timing of it, that matters. And you got to look at the whole clinical picture.
You got it. And remember those relapse rates we were talking about. For people who state what we call seropositive, meaning those antibodies are still there months later, some studies have shown rates anywhere from 24% all the way up to 88%. That's a huge spread, right? It just goes to show how much experiences can vary from person to person.
So even if someone gets over that first MOGAD hurdle, they could still be at risk for another episode down the line if those antibodies are, like, hanging around.
Yeah, that's a good way to think about it. It really emphasizes how MOGAD isn't just about, getting a diagnosis. It's about managing it over time, paying attention to how things change.
That makes a lot of sense. We've talked about who gets tested, what the results mean, and even a little bit about the timing, when to do it and whether to retest. But let's get practical for a sec. Where does this testing even happen? Do you have to go to some kind of super special lab?
It really depends on what type of test your doctor thinks you need. Remember those live CBAs,
Yeah.
the ones using living cells? Those usually require, well, specialized labs, places that have the right expertise. You might need a referral, or your doctor might have to send your sample to a different lab that can handle it.
Right, okay. But the fixed CBAs, those are more common, aren't they? The ones using the preserved cells.
Exactly. You're more likely to find those at those big commercial labs, maybe even some hospital labs, which makes them a lot more convenient for, that initial round of testing.
So it sounds like step one is really talking to your doctor, seeing if testing is even needed based on what's going on with you. And if it is, they can help you figure out which type of test is best and where to get it done. They're like your MUPDI-IG guide.
I like that, your MOGA-AG guide. And it's worth mentioning that the whole testing situation, like what's available, how it works, that can vary quite a bit depending on where you live and your healthcare system and all that. It's not always the same everywhere.
Yeah, that's true. Healthcare is rarely simple, that's for sure. Okay, so we've got the who, what, when, and how of MOG-IG testing down. But before we move on to all those real-world practical things you mentioned, is there anything else about the why we should cover?
You know what? There's one why that a lot of people don't think about, but it's actually really important. We mainly use this test to, diagnose MOGAD, but it can also help us rule over T other conditions.
Oh, interesting. So it's not just about finding MOGA, but sometimes about making sure it's not something else.
Exactly. Sometimes MOGAD can look like other conditions, especially early on. Take multiple sclerosis, for example.
So if someone has symptoms that could be either MS or MOGA, the MOG-IG testing can help narrow it down.
Exactly. Positive MOG-IG test, along with other things we see, clinical findings and imaging, that would make us lean more towards MOGAD. But if it's negative, well, then MS becomes more likely.
So it can be like a process of elimination, too, not just confirmation.
That's a good way to put it. And that's really important because, MOGAD and MS, even though they have some things in common, They often need different treatments.
Getting that diagnosis right is key, not just so you know what you're dealing with, but so you get the right care. Nobody wants to be on the wrong treatment path.
Absolutely. And that brings up another important point. Even though MOG testing can be super helpful, it's not like the only thing we use to make a diagnosis.
So you can't just look at that one test result and say, okay, case closed.
Right. You have to look at it together with everything else, like what are the person's symptoms, when did they start, their medical history, what do we see on their neurological exam, any imaging studies like MRIs. It all plays a part.
It's a piece of the puzzle, but not the whole picture. And sometimes, even with all the pieces, you might still have some questions or things that aren't totally clear.
That's very true. And that's why it's so important for the patient and their doctor to communicate well, to be open and honest.
Yeah, it's not like you just show up with a printout from WebMD and your doctor has all the answers, right? It's got to be a conversation.
Exactly. Patients should feel okay asking questions, sharing what they're worried about, and being involved in those decisions about their health care.
Yeah.
And doctors, well, they need to be clear, explain the test results and what they mean and what the next steps might be.
It's a partnership, right? You're both on the same team trying to figure out what's going on and what to do about it.
That's the perfect way to put it. Now, I know we've covered a ton, but we're not done yet. There are still some practical things, some nuances that can really make a difference for someone who's going through this whole MOG testing process.
I'm all ears. What kind of practical advice can we give to our listeners?
Well, things like how the testing gets billed and if insurance will cover it. How do you even find a good lab that does this kind of testing? And what should you ask your doctor to make sure you're getting the best care? Those are the things that can feel overwhelming, but we're going to break them down so they're easy to understand and, actually helpful.
Okay, love it. Let's dig into those practical tips right after this. Okay, so we're back and ready to tackle like the real world stuff when it comes to MOG testing. Because let's be honest, sometimes dealing with the healthcare system feels like you need an interpreter or something.
Tell me about it. And when you're talking about these specialized tests, the money part can be especially confusing.
Yeah, let's just get right to it, right? Money matters. How does this testing actually get billed? And will insurance usually cover it?
Oh, that's the million-dollar question, isn't it?
Yeah.
The thing is, there's not always a simple answer. Coverage can be all over the place. It depends on what your insurance plan is, where you live, even the lab that does the testing. It's kind of a mess.
So there's no guarantee that insurance will just pay for it.
I wish it was that easy. Some plans will cover it all, some might cover part of it, and some might not cover any of it. That's why it's super important to call your insurance company before you get the test. Ask them specifically about MOG testing and what they cover.
So step one is definitely call your insurance company. Avoid those surprise bills later, right? What other practical steps should people take?
If your insurance needs what they call pre-authorization, your doctor's office can be a big help. They're usually the ones who take care of that whole process, sending in the paperwork, explaining why you need the test.
Right. So don't be afraid to ask your doctor's office for help with that stuff. They deal with it all the time.
Exactly. And even if they deny the pre-authorization, don't give up. There's usually an appeals process. And again, your doctor's office can fight for you, help you get the coverage you need.
Okay, so insurance and pre-authorization, check. What about finding a good lab to actually do the testing? Any tips on how to find the right place?
With MOG testing, not all labs are the same. You want a lab that really specializes in this kind of testing and has a good track record for accuracy. It's kind of like choosing a restaurant, right? You wouldn't go to a burger place if you wanted sushi.
I get it. So where do you even start looking for these specialized labs? Should I just Google best MOG testing near me?
Honestly, your doctor is probably the best person to ask.
Yeah.
They often work with specific labs that they trust and can point you in the right direction to labs that, meet high standards.
Makes sense. What if you want to do a little research yourself? Are there professional groups or websites that can help?
Definitely. The American Association of Neuromuscular and Electrodiagnostic Medicine, AANM, they have a whole list of labs on their website. And there's the MOG Project, too. That's a nonprofit that focuses on MOGAD, and they've got tons of good info.
Perfect. We'll link to those in the show notes for everyone. Okay, you mentioned earlier how important it is to really talk to your doctor about all this. What kind of questions should people be asking to make sure they're, getting the best care possible?
Oh, I'm so glad you asked that.
Yeah.
It's really easy to feel lost when you're dealing with something complicated, medically. But this is your health, right? Don't be afraid to ask the tough questions. Be your own advocate.
I'm loving this take charge of your health energy. So, what are some good questions to ask about the lab itself?
First thing, find out what type of CBA they use. Remember, we talked about live and fixed CBAs. Ask them which one they use and why. Also, find out if they do the testing right there, in-house, or if they send your sample to another lab.
Yeah, good point. You want to know where your sample's going and who's handling it? What else?
Don't be shy about asking how long it'll take to get the results. Knowing the turnaround time can help a lot with, just managing those expectations and not worrying too much. And ask about their processes. How do they handle the samples? How do they store them? All that stuff is about making sure the results are accurate.
Okay, so we've got the lab questions covered. What about once you have the results? What should you ask your doctor then?
This is where it gets really personalized. Ask your doctor what your results mean, specifically for you. Don't just settle for a general explanation, but what do they mean for your situation, your symptoms, your history?
So, really putting those results into context.
Exactly.
Yeah.
You should also ask them, like, how confident are they in the diagnosis based on everything? Is it a super clear case, or are there still some, unknowns?
And of course, you got to talk about what those results mean for treatment and for like long-term care, what
Yeah.
happens next.
Exactly. It's super important to understand what it all means for your journey, right? It's different for everyone.
I like that you keep emphasizing your and my. It reminds us that this isn't just about like textbook stuff, it's about applying it to real life, to your life.
Absolutely. Oh, and another thing. It's always good to ask about the limitations of the test. No test is perfect, right? Your doctor should be upfront about the fact that there could be false positives or false negatives.
Right, no test can predict the future perfectly. Understanding those limits can help you look at the results in a more realistic way. What about like next steps and follow-up care? What kind of questions are good for that?
So once you have the results, you'll want to know if you need any more tests or evaluations. What are the treatment options, and what are the risks and benefits of each one? How often will you need to see the doctor, and what will those appointments be like? Are there any lifestyle changes you can make? Are there support groups that could be helpful?
So really thinking about the whole picture, right? Not just the test, but the diagnosis, the treatment, how you manage it all in the long run.
Exactly. And that whole journey, it's going to be different for everyone.
Wow, I think we've covered so much in this deep dive. We talked about the science, the practical stuff, even the emotional side of things. Any last thoughts for listeners before we wrap up?
Just remember, this is a field that's always changing. What we know today might be different tomorrow. So stay curious, stay informed, and keep advocating for yourself. Knowing what's going on, that's powerful, especially when it comes to your health.
I love that. Couldn't have said it better myself. And to everyone listening, if you're feeling overwhelmed or you have questions, reach out to your doctor, talk to your medical team. They're there to help you, figure it all out.
It's been great talking about all this with you.
Same here. And to everyone listening, thank you so much for joining us on this deep dive. Until next time, stay curious and keep learning.